To recap the week that was in politics, I'm joined now by CBC Saskatchewan political affairs reporter Adam Hunter. And Adam, I don't know that we've had this much happen in 1 week or ever seen so many people truly confused.
Yeah, there's a lot of information, Sam. It's coming fast and furious, really. If we look back to last Friday, that's when the first sort of set of new regulations came into effect. Those came into effect on Monday. And then on Tuesday, we had a second news conference in about 3 or 4 days. That was with Premier Moe and Dr. Shahab announcing more regulations. That was the province-wide mask mandate. That was the gathering limit going from 10 to 5, visiting restrictions in long-term care, and news that the government would be talking to the hospitality, worship service, and sports sector about potential restrictions or regulations coming there. That could be happening next week. And then just yesterday, of course, we had new modeling numbers provided by the government where we could be headed if we aren't careful and if we don't follow the public health guidelines. And of course, continuing messaging from the government and from Dr. Saqib Shahab about what people should be doing, going above and beyond, really, Sam, the recommendations that say, yesterday, Health Minister Paul Merriman said there's a strong recommendation not to have visitors inside your house that aren't members of your household. This is the first time we've heard this since very, very early on in the pandemic. The government's saying they prefer a slowdown rather than a lockdown. And of course, amidst all this, we have healthcare professionals, doctors writing letters to the government asking for a bit tougher restrictions, not a full lockdown, but definitely further than what the government has done to this point.
And we have a week now between, now and when the session begins. And this morning, Dr. Shahab was on the morning edition with Stephanie Langenegger and gave us a little bit of an idea of what we could expect.
Yeah, he says time is running out. That's really the simple way to put it for us to get the spread of COVID-19 under control. It's in every community in Saskatchewan. Really, if you look on a regional basis, the province is split into 13 smaller regions. When it reports COVID-19 cases, there are at least a dozen cases in all of those regions. Test positivity rates are high. There's especially a worrying trend up in the far north, in every part of the far north. And Saskatoon, of course, has very high numbers. So Dr. Shahab says people need to do their part. He says do half of what you've been doing. So if you go out for groceries twice a week, go once. If you go often to restaurants, maybe limit that, get takeout. And he says if we can scale back on who we're seeing, how often we're going out, we're wearing masks, we can continue to physically distance, try and work from home as much as possible, then we can get our numbers back under control. Right now, of course, we're getting upwards to 150, 200 cases on average a day. He says if we can get down to 60 or under, that would be great. He said he's comfortable, but it wouldn't be great at 120. But he said if we do this work and try and restrict our movements, who we see, who we interact with, follow these health practices, that we can get those numbers down to a manageable level. But Sam, remember, we won't see the impact of the measures that just came into effect this week until a couple of weeks from now. So people should expect to see numbers climbing continually over the next few days. And as you mentioned, the session starting on November 30th with a throne speech and an election of the speaker. And we can expect that even then, of course, that COVID will be dominating the discussion inside the legislature.
Thanks so much for this, Adam.
You're welcome.
CBC Saskatchewan political affairs reporter Adam Hunter in Regina tonight.